Every time we're going to do a central line dressing change, prior to entering the patient's room, we're always going to hand sanitize. We're going to go into the room and we're going to introduce ourselves to our patients and let them know what we're planning on doing.
Hi, Mrs. Monroe. I'm Larry. I'm here to change your central line dressing.
Oh, is it gonna hurt?
Not at all. I'll take care of it all.
The first thing we want to do is clean off our work surface area. We want to put on a pair of clean gloves, remove all the items off the work surface area. We want to go ahead and use a hospital-approved sanitizer, clean off the work surface area, and allow it to dry based on hospital policy, and then remove our gloves. Now we're ready to do our central line dressing change. Once our work surface area is clean and dry, we're going to go ahead and open up our kits. You'll see that once you open up your kit, there's a removal and an application pouch. Go ahead and rip those open and set all the contents to the side. You'll see as well, there's step-by-step instructions there to help you out. Before we go ahead and open up our sterile field, we want to don our mask, don our cap. We want to mask our patient and anyone else in the room. We then want to hand sanitize, and then we want to put on our gloves. Just remember that both pairs of gloves are the same. Use one pair of gloves for your clean dressing removal and the other pair of gloves for your sterile dressing application. If at any point in time you think your gloves have gotten contaminated, take them off and get a new pair. Next thing we're going to do is open up our sterile field. We want to always be careful when we open up our kit to pinch the outer edges of the kit, being careful not to contaminate our sterile field. Here's an example of how we don't want to open up our sterile field. Getting our hands into the sterile field and contaminating our supplies. Okay, now it's actually time to remove the old dressing. The first thing we're going to want to do is locate the V-notch, which is in the back of the dressing. There's a perforation there. Go ahead and tear that, pulling in opposite directions. Next thing we want to do is lift up the dressing around the outer edges. And if you need help, go ahead and use your alcohol swab stick. That'll help remove some of the stickiness around the dressing. Peel back slowly and keep the dressing close to the skin, and follow the catheter towards the insertion site for easy removal of the dressing. Hold on to the catheter at the lumens just to prevent that catheter from becoming dislodged. But be careful not to touch the catheter and contaminate it. Once we remove our dressing, we're going to go ahead and discard the dressing, remove our gloves, and go ahead and hand sanitize one more time. The next thing we want to do is don our sterile gloves. We want to apply our sterile gloves using a sterile technique. If you decide that you want to use a sterile drape, go ahead and grab it out of your extra items pouch. Drape your patient shiny side down. Now we're going to go ahead and clean our patient's skin. That's step one in your dressing kit. This is the most important step in making sure that we prevent infections. We're going to pinch, apply, and dry. We're going to pinch our wings, apply the sponge, allow the chlorhexidine to activate, and we're going to friction scrub our patient's skin back and forth for 30 seconds. Imagine the size of your dressing. It's about 4 by 5 inches. We want to scrub an area that goes just a little bit beyond that dressing. So sometimes I feel like I need to hold on to my patient's catheter to stabilize it and prevent it from becoming dislodged. There's some 4x4s in your extra items that you can use. I use those to hold on to the catheter to prevent myself from contaminating the end of the catheter. So then after we scrub for 30 seconds, we're going to allow our patient's skin to dry for at least a minute or until completely dry. Some of our patient's skin doesn't dry in exactly 1 minute. Some people take a little bit longer, so we have to wait until it's completely dry. Make sure you let that chlorhexidine dry because your patient could end up with a chemical burn. So if your patient has a sensitivity to chlorhexidine, we're going to use the same method, but we're going to use 3 swab sticks of alcohol and 3 swab sticks of betadine and allow it to completely dry. After we've allowed the skin to completely dry, we're going to go ahead and apply our dressing. The first thing we want to do is apply our antimicrobial patch. It's step 2 in your dressing kit. You want to make sure that you have the grid side facing up. The next thing we want to do is make sure our slits are facing towards our lumens and our catheter just sits just about 5 to 10 degrees to the side of the slits. Make sure you don't place your catheter right on top of the slits. In our dressing kit in step 3, we have the option of using SurePrep. It's an optional solution that we can use to place around the edges of the dressing. I only use my SurePrep if my patient's skin is oily, there's hair, or there's moisture under the dressing. Okay guys, we're ready to go ahead and apply our sterile dressing. We have our shirt, our pants, and our belt. So let's go ahead and apply our shirt. The first thing you want to do is peel back the adhesive to be able to position it with the clear window not only over your catheter, but over your insertion site. Make sure that not only your catheter, but your suture wings are contained under your clear window. Apply the dressing and press down around the edges to ensure that the dressing is adhered to the skin. The next thing we want to do is apply the second piece of our dressing, which we call the pants. We want to make sure we slide it completely under the tubing and over the dressing before we remove the adhesive backing, fitting them snugly under the lumens. Then go ahead and remove your adhesive backing. So the last step in the dressing application is applying the belt. The belt is meant to prevent the pants from peeling up. Apply the belt and securely just fasten it across to tie the shirt and the pants together. We're finally done with our dressing change. The last step is going to be to date and initial our dressing. You can either write your date and initials right on the dressing, or you can use the label that's on the back of the liner.